evidence-based programs. Empirical and evidence-based programs. Evidence-based care has become an increasingly important priority within the medical and mental health service professions. Evidence-based practice, or EBP, emphasizes the importance of treatment strategies and clinical practice that have demonstrated efficiency and effectiveness. Some narrowly define EBP and emphasize only empirical evidence. This presents a challenge for African Americans and members of other ethnic groups, as there have been critiques that ethnic minorities, including African Americans, are largely missing from efficiency studies for mental health interventions. Promising practices for increasing cognitive and language skills. Culturally responsive classrooms. Understanding learning and language styles of African American children could contribute to their educational success. Asia Hilliard, one of the country's foremost experts on cultural issues in education, wrote, "All students have an incredible capacity for developing the ability to use multiple learning styles in which the same way that multiple language competency can be accomplished. Culturally responsive teaching is defined by Gay as using cultural characteristics, experiences, and perspectives of ethnically diverse students as conduits for teaching them more effectively. Increasing cognitive and language skills include strategies when working with African American children. That includes where most of the work on learning and cognitive styles has been conducted in the field of education and has specifically focused on classroom environment and curriculum development in multicultural classrooms. Barbara Shade identifies strategies for cultural groups. Shade, citing the work of Janice Hale and Joyce King, along with her own, offers these suggestions for those who are working with African American children. Shade also believes that although these suggestions are designed for younger students, they may also work for the older ones. The recommendations included providing effective or emotional support that may include small group learning, peer tutoring, and grouping of different students in a manner that resembles family, providing tasks that will give students a sense of combined responsibility for their learning and the learning of their peers, providing opportunities for students to explore their community and encourage them to use their knowledge for the benefit of their community, provide opportunities in academic tasks where students can develop or enhance their self-concept, and identify and provide opportunities for creative expression. Expose students to African and African American culture and traditions, including meaningful curriculum and symbolism of African or African American traditions. And lastly, provide sufficient opportunity in which children can talk and express themselves and give them the opportunity to hear music while they work. Improving language skills. Um, According to Smitherman, educational and institutional policies should recognize the legitimacy of Black English. Black English could be a language of construction, especially among children who live in environments where it is spoken. Black English is functional for most Black people and a valid means of communication. Hill made the following recommendations to teachers who have students who are Black English speakers. Never tell students the language they speak is wrong or that say is correct. Help motivate students by exploring how they express common ideas before emphasizing grammar rules. Provide students with written feedback when they are using safe features. Model corresponding grammatical features used in Black English and in Say. Inform students that everyone speaks non-standard English and explore additional forms of English to compare. An example of that would be identifying characters from different cultural groups on TV, different cartoons and stuff like that. Wheeler suggests teachers put away the red pen and provide structured instruction and code switching to help urban African American students use language more effectively. Using the oral tradition to improve learning. According to Grace, effective teaching strategies could consider aspects of the African American oral tradition that facilitate engagement with literacy practices. Culturally conscious hip hop is oral text with lyrics and messages that enlighten with social consciousness, engage with politicized messages, and empower by instilling cultural and self awareness. The infusion of African American oral tradition requires a teacher who is willing to be a co learner with students. It requires a teacher who is unfamiliar with specific cultural practices of his or her students to be willing to learn about them. And lastly, it requires the establishment of a safe and trusting learning environment by encouraging the acquisition of knowledge through cooperative learning. Supported practices for reducing morbidity and mortality. Ways of reducing health disparities must take into consideration changes at the individual behavior level, as well as broader changes in systems, including how healthcare is delivered in this country. They discuss system level changes followed by empirically supported programs that have reduced the risk of HIV, and diabetes. The practices include system level changes preventing HIV and reducing diabetes. The practices. System level changes. Satcher discusses several system level changes for reducing health disparities among African Americans. Programs to promote better health are more likely to be achieved when researchers and health professionals work collaboratively with key community stakeholders. Some effective programs and interventions that have involved community partnerships include interventions that reduce cardiometabolic risk among high-risk African American women, preventing HIV. Billings conducted a randomized trial to evaluate the efficiency of a web-based HIV behavioral intervention for African American women. The intervention was called Save Sister, where the goal was to increase condom negotiations and steady relationships because most African American women were affected by their male partner. Reducing diabetes. The Diabetes Prevention Program, or DPP, was a large study funded by the National Institute of Diabetes and Digestive and Kidney Diseases. The multi-site study investigated whether small to moderate amounts of weight loss and increased physical activity or treatment with oral diabetes drug medication could prevent or delay the onset of type 2 diabetes. Evidence-based and promising practices for reducing racism. Most empirical studies in psychology have targeted the individual in programs to decrease prejudice and racism. A vast amount of that research comes from social psychology. Ponteroto, Utsi, and Peterson, in their book Preventing Prejudice, offer several research-based practices for ways in which teachers, counselors, and parents can improve race attitudes among elementary, middle, high school, and college students. Their practices included contact hypothesis, where much of the work done in school settings on reducing prejudice and racism has been derived from the contact hypothesis. Superordinate group memberships, when superordinate group membership is salient. Differences on other attributes, examples race and class, are less relevant. Societal approaches to decreasing racism. Societal approaches to decreasing racism have been studied in the field of sociology more than psychology. They focus on changing norms, laws, and policies that support racism. Evidence-based practices for improving educational outcomes. There have been several interventions and programs targeting educational experiences across different developmental periods that have shown effectiveness and promise in supporting strong educational outcomes among African Americans. An example is the Ramses in the Abecedarian, and related studies have supported the importance of quality preschool education. Educational experiences supporting excellence and focusing on the specific educational needs of African American youth have shown promise in supporting positive educational outcomes for African Americans. African American students are disproportionately suspended and expelled from school. Restorative justice practices are evidence-based practices that have been used to reduce the percentage of racial and ethnic minority students who are expelled and suspended. The relevance of these studies. These programs and practices are essential for the development of African American adolescents. The programs helped with racial socialization by teaching African American adolescents about discrimination and activism. African American adolescents are provided with mentors and role models. African American adolescents gain knowledge in important topics such as discrimination and health, and adolescents can submerge themselves within the African American culture while developing life skills at the same time. Some thought provoking questions. Based on the programs, would you be able to identify an adolescent to the proper one based on their actions and or educational needs? What do you think could be done to better these programs for future and current African American adolescents? And lastly, what is something new you've learned about any of the programs that you didn't know already? And my references, that's my presentation. Thank you.